Everyone has been talking about the fallout from Nicki Minaj's testicle tweets, which has affected everyone from the White House all the way to the government of Trinidad and Tobago. And since we don't actually live in Trinidad, well, we thought it would be helpful to have a conversation with the actual Minister of Health for Trinidad and Tobago. So, Minister Deyalsingh, welcome to The Daily Show.
Trevor, how are you doing?
I'm doing well. Thank you so much for taking the time today. I know you've been inundated, and I really do appreciate it. So, I really appreciate it.
Anything for an honorary Trini.
I try my best. I've been told if I don't attend the next mass, I'm going to lose my citizenship. So,
exactly.
Marshall has told me I need to play his band and make sure that I fit into my outfit for the next mass. So,
lovely.
A few days ago, Trinidad and Tobago was thrust into the spotlight in not the most favorable way because of what could have been an innocuous tweet where it's tweeted by anybody else. But Nicki Minaj tweeted something that has thrust yourself and your team into the spotlight. And I figured it would be great for you to come on the show and just to help us work through some of the misinformation that is swirling in and around the country right now. So before we get into the story itself, I would love for you to know, is there anything you want people around the world to know about how Trinidad is handling the COVID crisis?
Thank you very much, Trevor. So I think Trinidad and Tobago is fortunate to have as a Prime Minister the Honorable Dr. Keith Rowley, who is a scientist at heart. That, married with his political skill, led us to take very decisive action on COVID-19 from February 2020. That decisive action stretched from closure of borders to public health measures and to now to acquiring vaccine. The setting up, Trevor, of what is called a parallel healthcare system, which is where we put aside 1,022 beds only to take care of COVID patients so that our regular hospitals were unaffected. And I think that has worked wonderfully well. Also, when we marry that with our homegrown health expertise, our public health experts, the dedication of our doctors and nurses and everyone in the public health system has brought us to a place of relative comfort so that we could save as many lives as humanly possible.
So you held a press conference that has now gone viral worldwide where you had to come out and state publicly that there is no case of testicular swelling happening in Trinidad. Well, vaccine related at least. And so I wondered, from your ministry's side, do you have any concerns in and around the vaccine? Is there anything that has made you say, oh no, people need to pause, or is there a rollout of the vaccine that you are comfortable with right now?
Thank you for that question. So as part of our communication strategies from day one, we had press conferences every day. Right now we have them 3 times a week. So that was part of our normal communications process yesterday. To date, we have administered over 1 million doses of vaccines in a country of 1.4 million people. We're a small but proud country, small but proud. And we are confident that we have brought WHO-approved vaccines to Trinidad and Tobago. And with those million doses we have administered to date, there have only been 5 cases of adverse events, all reported to WHO. None of them includes testicular swelling. And let me just reiterate, when one weighs that against the ravages of COVID-19 around the world, where close to 4.6 million people have in fact died, the advantages of vaccination far outweigh the minuscule risk. So the message is, get vaccinated. Vaccines are safe, they are effective, and they will save your lives.
Now, because Trinidad, doesn't have the same standing as the United States, obviously the information that people get from around the world can be a little misleading. Myself included. My friends from Trinidad had to inform me that Trinidad doesn't just have one vaccine. It's not just the Chinese vaccine, Sinopharm. Trinidad has multiple vaccines, and I figured since we have the Minister of Health here, you would be able to clarify on that. Which vaccines does Trinidad have access to?
So from day one, Trinidad and Tobago's government's policy, led by the Honorable Prime Minister again, has always been to only bring in WHO-approved vaccines to Trinidad and Tobago. That way, the population can be comforted and reassured with the stamp of approval that these vaccines have been properly trialed, properly tested, they are effective, and they are safe. To date, we are now spoiled for choice. We have the Sinopharm vaccine from China, excellent vaccine. AstraZeneca, another excellent vaccine. Johnson & Johnson, excellent vaccine. And the Pfizer vaccine, which is the only WHO-approved vaccines for children between the ages of 12 and 18. The vaccines are conveniently located. For a country of 1.4 million people, we have over 300 access points. The vaccines are free. They are accessible. We just walk into any one of those 300 access points and you can be vaccinated in Trinidad and Tobago with any one of the 4 world-class WHO-approved vaccines.
And then what of Nicki Minaj's further claims that nobody in Trinidad can work if they are not vaccinated? Is that true?
Well, I welcome the opportunity to put the record straight in simple language that is simply not true. Our vaccination program is voluntary, but highly recommended. And Trinidad and Tobago, as part of the PAHO region, has a proud history of vaccinating children from the ages of 2 months. As a matter of fact, our MMR vaccination rates are 95%. And vaccines are not new to the region, to the Caribbean, to Trinidad and Tobago, and to the PAHO region. This is not new. What is new is social media trying to throw doubt on this vaccine. But globally, my friend, 5.83 billion, listen to that, 5.83 billion doses of vaccines have been administered globally, and it will save lives. And Trevor, if you want to come back here to play mass, get vaccinated and come back here. Right?
I mean, that's a great way to get people to come back.
I will personally take you to eat doubles. I will personally take you for coconut. I will personally take you to Tobago.
So let me ask you this. Let me ask you this, Minister. You're dealing with a crisis like many other health ministers in many countries around the world. No country has been spared from this pandemic. Is it a little tedious for you to have to come out and deal with something like this from Nicki Minaj? I remember it was maybe, a decade ago when Nicki Minaj claimed that Trinidad had 250,000 cases of HIV/AIDS. I think it was a number that was well inflated, over 10 times what the number actually was. Does this almost distract from what you're actually trying to do?
Not really. We are in a job of communications. We have to communicate. We have to communicate facts. And we have moved from the old days, from the old soapbox, where you stand up on a soapbox, give a message, now to the electronic soapbox. The electronic soapbox demands now that we communicate differently, instantaneously. We are focused on service. We are focused on family. Trinidad is a prayerful country. And whenever we have to defend the integrity of Trinidad and Tobago, it is up to people like myself to defend that integrity by giving facts.
So if you had a message for Nicki Minaj, who has now said, that her family, you can't get Instagram or you can't do social media in Trinidad. Some people interpreted that to mean that the government is blocking you if you say what you want to say in Trinidad. If you were to send a message to Nicki Minaj, what would that message be?
So again, putting the record straight, Trinidad and Tobago has an internet penetration rate of 84%. Our mobile penetration rate is 158%. We have free speech as guaranteed in the Constitution. My message to the Trinidad and Tobago diaspora, anywhere that you are, is that vaccines are safe, vaccines are effective. And if I may broaden the conversation to the Caribbean diaspora, the Caribbean is one of the best places in the world to live and play. It is one of the best places to bring up your families. My message to the Caribbean diaspora is spread the word that get vaccinated to save your life so we can get back to our Caribbean way of life, whether it's soca, whether it's reggae, whether it's playing steel pan, um, all these lovely things, cricket, football, right? Chutney, all these things. The way out of this pandemic right now is simply get vaccinated.
Well, I'll tell you now, Minister, you had me at doubles and playing mass. I'm going to try to lose a little bit of my COVID weight, and then I'll be back. Maybe we'll be playing in the same band. You never know. We'll make it a special
I
occasion.
will play with my friend, and my children and Nadia are great fans, and they will play with you.
Thank you so much. Thank you so much for taking the time, Minister. Appreciate you.
You're welcome, my friend.